Phase 3 clinical trial. This is the last hurdle before a new treatment can be approved, bringing health benefits to millions of patients and a windfall of profits to large pharma companies. It takes years of research, testing, and clinical validation to get to phase 3. Yet, 30% of phase 3 clinical trial fails, costing the pharma industry nearly $20 billion each year and delaying patient access to the next generation of care. The reason for this failed trial is the fact that people with the same disease react differently to the same treatment. We've known for a very long time what needs to be done to create drugs that pass phase 3. And this is unlocking the human puzzle to understand the differences between patients. Thanks to the advance in science and technology, this long-lasting goal is becoming a reality. My name is Sarah Jenna, co-founder and CEO of My Intelligent Machines. At MIMs, we develop systems biology software to help biopharma companies unlock the human puzzle and develop more efficient treatment. And this is not a theoretical exercise. Despite only launching 3 years ago, we have already signed $5 million contracts with the biopharma and hospitals. MIMS software models patients into knowledge graph that could be used for drug discovery. Building this graph and understanding the difference between patients requires the integration of information on patient genome, their clinical and physiological data, on their environment, and on knowledge coming from the literature. To do so, even biggest organizations face 5 major challenges. They struggle to build multidisciplinary team with expertise in systems biology and AI. They need to acquire knowledge coming from the literature, which is dispersed in hundreds of databases worldwide and mostly in unstructured format. They have to deal with very sensitive and heavy data, which involves computing and security challenges. And they need to make this new discovery process adopted by life scientists without expertise in computer science, who represent 80% of their employees. MIMS software helps them resolve these challenges. It provides them with integrated solution for patient modeling, used for patient stratification, target, and biomarker discovery. It brings comprehensive and up-to-date knowledge base aggregating data from structured and unstructured sources. It brings a secure and robust cloud computing infrastructure enabling distributed computing and federated learning. Finally, it does much more than helping adoption by life scientists. It actually amplifies life scientist abilities in drug discovery by creating a synergy between the expertise of the scientist and the modeling abilities of the machine. MIMS technology capitalizes on 30 years of expertise and more than 30 peer-reviewed publications. I myself, a former Canada research chair in systems biology. My co-founder and chief scientist, Abdullah, recently received the next Einstein Fellow Prize for his career in bioinformatics and machine learning. And Michael, our CTO, is an AI specialist who worked with the European Defense and Space Agencies. We discriminate ourselves from digital pharma and bioinformatic AI SaaS companies by the strength of our systems biology approach and by the fact that we are the only true augmented intelligence system in this space. Our solutions are used in Canada and Europe, and we are currently signing our first client in the US. Over the past 2 years, we signed $5 million contracts with 8 large clients, including big pharma and hospitals. They use our solution in oncology, autoimmune diseases, and COVID-19. We generated last year almost $1 million revenue, and 5 months before the end of our current fiscal year, we have already ensured 110% revenue growth. We expect our revenue growth to reach 150% over the next year. There is a lot of excitement around us. Last week only, we have been selected as one of the 6 finalists of the French Founder Tour of America competition, and by Red Herring as part of the top 100 tech company in North America. Based on these successes, we're ready to move to scaling phase. And for that, we're raising $10 million Series A in January to consolidate our leadership in Canada, Europe, and US, and to reach $10 million annual revenue. If you want to participate to the next big transformation of the biopharma industry, please contact us.